Hello, everyone. This is Erin Verdile. Welcome to our second New York Connects quarterly webinar. We have a pretty packed agenda today. The way the agenda will flow is that we'll begin with some updates and reminders, and then we'll focus in on our spotlight topic, and then turn it over to our guest speakers for a peer-to-peer portion. And then what we will ask of you is that if you do have questions throughout, to please use the chat, because after our guest speakers present, we will then have a dedicated portion of the call where we will be reading off the chats that have come in throughout and provide opportunity for a Q&A with both myself, who will be reviewing some training content, and then again from the presenters from the local New York Connects. So please, if you have a question, so that you don't forget, enter it into the chat and we'll get to it then. Mute is on for everybody, but during that chat portion, if you do have a burning question or you'd like to add a comment, just raise your hand or type it in the chat that you would like to be unmuted, and we can do that for you. We will not be taking attendance today like we did during the last call. That was very time consuming. We were able to find out that we can generate an attendance report from WebEx, so we will be able to do that. But if you are calling in by phone and not logged in, we will not be able to get that information from the report. So we ask that you please reply to the calendar appointment, just letting us know that you were on. So thank you for doing that. And just one last housekeeping, we've extended these webinars by 15 minutes, but if you need to jump off at 3:30, that's fine, please do so. It is being recorded and we will share the recording as well as the PowerPoint slide deck. And with that, I'm going to turn it over to, I want to review our objectives. We added these objectives just so that everyone understands really the goals for these webinars going forward. And the objectives are to share information on relevant reminders, updates, and new initiatives, to provide refreshers and resources to support the effective delivery of New York Connects functions, and to provide an opportunity to learn from your peers. So those are the objectives that will carry forward throughout the year for these webinars. And now I will turn it over to Diane, who will do some updates and announcements.
So I will unmute. There I am. Hello, everybody. Updates and announcements. Here we go. The New York Connects reporting PI was released on February 15th. That serves as a companion to the information that's collected on the New York Connects reporting website for the qualitative data, provides notes on any qualitative or quantitative changes from the prior year. It includes a helpful table of requirements with quarterly due dates and a tip section at the end. We also have a few repeat reminders from our last webinar. The no-cost extension for ADRC COVID grant and ADRC COVID vaccine supplemental grant has been until September 30th, 2023. And you can reference the January 11th email that went out from Mike Gunn for more info on grant and how the monies can be spent. One note is the correction to that email for the date the grants end. The correct date is September 30th, 2023. The email said August 31st, 2023. I'd like to remind everyone that there are flexibilities with the grants, and ACL has approved many innovative requests for use of the funds as long as they align with the goals and purpose of the grants. So reach out to your NYSOFA New York Connects coordinator with any questions or proposal. Our next quarterly New York Connects report covering the period from January through March 2023 is due on April 30th. As a reminder, staff are encouraged to attend peer place calls and required to attend care director calls. Another reminder is the ACUU conference is Monday, June 27th and Tuesday, the 28th. And with that, Erin, I think that's back to you, isn't it?
Yes, thanks, Diane.
You're welcome.
And so thank you. So we're going to dive right into our spotlight topic for today. So as I said before, I am going to be reviewing a couple of training resources that our team here at NYSOFA has been able to take, and we are strongly encouraging for all local New York Connect staff who have any kind of public-facing role. So that would include intake staff, administrative staff, really anyone who interacts with the public. We are strongly encouraging that you take these trainings that I'm going to review in a moment. And so what I'm going to attempt to do is pull up the training platform. All right, thumbs up. Jen, is it showing the Advancing States platform?
Yes.
Okay, thank you. And so this is the platform that we're showcasing today, and it is called Advancing States. It's a portal. If you see here, right up here in the top left, there's a button called IQ Online. And with that, when you click on that, that actually pulls up the training portal that I'm going to review in a moment. But just in terms of background information, so the Advancing States portal, it includes a variety of resources and trainings that are intended for the Aging and Disability Resource Centers, no wrong door systems, and for staff that regularly interact with the public to provide information and assistance on long-term services and supports. So the Advancing States manages the National Information and Referral Support Center that's funded by the Administration for Community Living, the Alliance of Information and Referral System, also known as AIRS, the National Association of Area Agencies on Aging, commonly known as N4A, and the National Council on Independent Living. The center offers training for those who provide information, referral, and assistance to older individuals, people with disabilities, and their caregivers. Trainings and webinars are a combination of skills-based and informational, but they're very resource-focused. And today, again, I'm going to talk about two that are most directly related to the delivery of information and assistance. So we've received a number of requests for technical assistance to focus on the common weak spots that were revealed from last year's call testing process. So we thought that these two trainings really showcase some of those areas. And we also refer you to the recording from our prior webinar in February, where we reviewed the particular New York Connect standards that pertain to a number of the call testing areas that identified areas for improvement. And before I show a little bit of the portal, I also want to welcome Nanette Relav to today's webinar. Nanette, I saw you chatted me in earlier, so thank you so much for being on. Nanette is the Senior Director of the National INR Support Center, and she's been an incredible resource to us as we've been navigating some of these trainings. And so for the first one that I'm going to dive into, let me pull up Chrome here. Okay. Let's see. Okay. So as you'll see, the second view that I'm showing you is where I'm already logged in. So up at the top right corner, you'll see my initials, and I'm able to click on my courses to see the whole list of the courses that I've already completed. Now, you do have to create an account to use this platform, but it's at no fee. And once you create an account, you will be sent an email with a confirmation. And so for today, the two courses that we're going to just introduce you to are within the Consumer Access to Services category. And so, but you'll see that there's so many different topic areas that might be relevant to your work. But for today, we're going to showcase the two that are most related to INA, if it pulls up here. Sometimes I should note that this site can be a little bit slow, so you just have to be patient, especially when you're pulling up videos. It can take a few minutes. And so, pulling to page 2. Okay, so here we go. So for the first one that I want to touch on today, is key communication techniques for aging and disability professionals. So if you click on the training, you'll see that and this is most often the case with a lot of these trainings, they'll have the narrated PowerPoint right here, and that's really the training that we would direct you to. That's the full training with the recording. But if you just simply want to click through the slides without listening to the recording, you can also access the PowerPoint. And then there's a written companion document and then a syllabus, which just breaks out what will be covered in the training. So for example, if you wanted to share the syllabus with staff in advance. Okay, and the topics for this particular training, the topics that are covered include key communication techniques, avoiding communication blocks, tips for effective communication with older adults and persons with disabilities, communication and disability awareness, the importance of language, and key takeaways. So this training, I also wanted to note that it also includes strategies for de-escalating challenging situations, such as encountered with angry or frustrated callers, frequent callers, and working with emotional clients who may be in despair. These were the top identified training needs from the poll that we took during our last webinar, and also we received a number of requests for these types of resources. And I just wanted to note, and I don't know, Diane, if you're able to chat a couple of these resources into the chat. There are two resources that I'd like to share that may help you respond to callers with these kinds of emotional support needs. And the first is a crisis service that's available 24 hours a day, 7 days a week, free of charge. And that is 741-741 or GOT5. And also the 988 text or phone number resource. That is being heavily promoted across the country. I know I saw ads for it during the Super Bowl. They have a Spanish-speaking option and an option for the LGBTQ community. And so we would definitely encourage you to check out those resources. And there was an email, but I'm not really seeing that I could, well, we'll send the email out after the training. There is an email that accompanies the 988. And so with that, I'm going to, seems like I'm losing my portal. It keeps pushing me back to the PowerPoint. Okay, so I'm going to return back. And then the other training that we wanted to introduce today, let me see if I can see it right here up top. It's essential components of the aging information. Yes.
Could I hop in just a minute? We had a question in the chat to ask if there's a charge for the online learning.
Oh, no, there is no charge. No, there's no charge. And we'll be getting to the two additional questions later. But yes, please chat in as you think of them. So the other training I wanted to just briefly touch on is called the Essential Components of the Aging Information and Referral / Assistance Process. And so for this training, although the title of the training specifies aging, the information in it is incredibly beneficial to working with all different populations and is representative of the roles and functions of all types of INA specialists, especially those within aging and disability resource centers, which, as you all know, in New York, that is the New York Connects No Run Door system. The module provides step-by-step comprehensive analysis. Sorry, everyone, my slides keep moving around as I'm looking through my notes. It provides step-by-step analysis of the information referral and assistance process and offers the opportunity to learn and apply communication techniques to support older adults, individuals with disabilities, and their caregivers. So I do want to note that there is a little bit of overlap in content with this training and the prior one that I touched on. But the information is presented in a different way, so it really serves to reinforce the concepts and tips. The one section that does have the redundancy is section 2, but you are able to skip ahead and you could scroll through the recording at the bottom using the scroll bar. So the content for this, I want to make sure I get everything on closed captioning. I'm going to read it off. The content includes welcome and establishing rapport, assessment of the client's disposition, request, or situation, and in terms of New York Connects in New York, that translates to our general screening. Clarification, information giving, referral assistance giving, and closing. When applicable, they do touch on tips for advocacy and empowerment on behalf of a client. And so before we move on to the other part of our agenda, and just again, reminder that you can certainly ask questions about what I've gone through today, but that will be during the chat portion. But before I do that, I just want to say that really we're just touching on a couple of trainings today, but this platform is an amazing resource. It has a host of available webinars, printable resources, and we really encourage you to kind of scope it, click around and scope things out. The other unique thing I wanted to mention is that some of these webinars, including the two that I reviewed today, will ask you to click on an enroll button. And what that does is it generates an email to your email account that you use to create your learning account. And then what that will do is at the end of the webinar, when you've completed it, you'll be emailed a certificate of completion to yourself. So we do ask that if you are able to take these trainings, that we would like to have you email that certificate. It's a printable certificate of completion, and we ask that you email that to your NYSOFA New York Connects coordinator, so that we can, we are aware of your efforts. We appreciate, all training related activities that you're engaged in. So that is a nice feature about the system. I do also want to remind everyone that we do have our available course skill refresher on INA, options counseling, and person-centered counseling part 1 and 2 that is on the NYSOFA training page under the providers tab. Now, although the format is not ideal, it does cover the essentials in terms of expectations for INA, and you are able to skip ahead to certain sections during that recording as well. It is a YouTube video. And we did send that link out as a follow-up to the February call. So I believe we are now ready to move on to our next topic. I'll turn it over to Amy. We did choose the next topic, which is about moving on to that slide. Hopefully it's showing for everybody. We chose a topic focused on information and assistance related to callers with mental health needs or perhaps emotional support needs, like I touched on earlier, mainly because of feedback that we've received from the local New York Connects in terms of requested training and based on our polling results that we did in February. So we were able to have a great representation today from 2 local New York Connects, or two programs that we're going to hear from now. And I think with that, I'll stop talking and I'll turn it over to Amy Hegner.
Thank you, Erin. And as you mentioned, we have 2 counties that we are grateful to for stepping up to present the specific situations that they have going on in their particular areas. And those 2 counties are Orange County and Cattaraugus County. And they're going to be discussing, as Erin mentioned, their best practices related to effective partnerships that they've established in their localities to kind of address these more complex and sort of heightened emotional states of callers that have been recently contacting more often. So first, we're going to start with Orange County, and we have Anne-Marie Maglione, who's the director of the Orange County Office for the Aging, and also with Anne-Marie is Kristen Moses Westfall, and she is with the Orange County Department of Mental Health. Together, they're both part of the Welcome Orange Geriatric Initiative, which is also known by its acronym as WOGI. So I was hoping that Anne-Marie, maybe you could start us off by just kind of giving us a little bit of an overview of how New York Connects is structured in Orange County.
Yeah, thank you for having us. We're really thrilled with this important partnership that we've been working on for several years now. Like other AAAs, New York Connects is our single point of entry. And even post-pandemic or pre-pandemic, we were getting a lot of mental health calls, loneliness, isolation, depression, anxiety, suicide. The calls were just going up in numbers. Post-pandemic, it's really gotten even worse. We all know loneliness and isolation is a huge, huge thing. We started a relationship and a collaboration with the Department of Mental Health with Welcome Orange Geriatric Initiative. And it's a really essential tool for us to be able to use when I have my aging service specialists who are trained to answer any variety of calls for New York Connects. But when one is involving mental health, it's really great to have a valid, important tool that we can do a soft handoff. So my aging service specialist does, they do their assessment, they talk to them, and they're able to really draw out, is this a 911 call? Is this a 311 call? Is this more of a conversation to come up with a mental health plan? And when that happens, we do the soft handoff to WOGI. What also happens is people don't call. Some people call. The majority of the people don't call and say, I'm depressed, I'm suicidal, I'm lonely. They'll call for a different service. And as we are doing the assessment, it's almost like peeling the onion, and you realize that the core of this is a mental health issue. And again, to be able to have something to then say, we're here with you, we're going to help you, and give them the soft handoff is wonderful. Because the worst thing you can do is say, you know, I empathize with you, I think it's an issue, but right now we don't really have an answer for you. So to be able to have an answer, we've been doing this for quite a while. It's a very strong tool in our toolbox. And we're thrilled that we have it with them. And mental health, and Kristen Moses Westfall is just wonderful to work with. We just partner together. We talk about the cases. We talk about what we can do, and it's a great partnership collaboration.
Great, thank you so much. And Kristen, I don't know if you want to kind of, and I know you have a few slides here, Erin. Am I able to advance those, or do you have to do that on your part? And Kristen, if you could just give us an overview of who the partners are. I know Anne-Marie touched on that a little bit, but you know, who the partners are, how you came together, and a little bit of you know, how that the WOGI, sorry, I said WOGI with the hard G before, but the WOGI partnership came together.
No, absolutely. Thank you so much for the opportunity to share. We really appreciate it. So much like you work in your work, and it sounds like with New York Connects, have very much a philosophy of no wrong door. In the behavioral health system in Orange County, we also have that philosophy under Welcome Orange, and we have you know, countywide meetings and ongoing trainings as there's turnover in all of our behavioral health staff countywide. And there's just a natural sense of collaboration with a lot of the agencies already. So that being said, there is an ongoing grant process with the state that's a collaboration between the Office of Aging, OASIS, and the Office of Mental Health, really creating a triple partnership in the county to meet the needs of folks who are 55 and older. So that we are in the second grant round. So we've been doing this for 7 years now. And our partners are the Department of Mental Health. We do the administrative piece, obviously the Office of Aging, and the other agencies listed on the screen: Catholic Charities, Jewish Family Service, Mental Health Association, RSS, and new to the grant round this time is Independent Living. And I will explain what we all do if you can advance the slide. So we all, as I said, you know, have a long history of working together. And the county, as the Department of Mental Health, we were the official grantee, writing the grant. We provide a lot of the grant management and administration. We also provide direct in-home mental health treatment. I have been one of the clinicians for more than 5 years now. So going out actually into people's homes for individuals who can't make it to a clinic for a variety of reasons, health reasons, transportation reasons, things like that. So we can provide direct in-home mental health care. Catholic Charities provides a substance use treatment. Mental Health Association provides our gatekeeper, who is the single point of access almost for all of the programs within WOGI. And they also have a socialization component. They do some social clubs, and they have a compeer program who provides one-on-one socialization with individuals with mental health diagnoses. RSS, Rehabilitation Support Services, provides our medication adherence counseling, which really has been life-saving for some of our folks. When staffed, I know we're all suffering staff shortages, but when fully staffed, they are actually able to go out into individuals' homes and help organize medication cartridges to make sure folks are taking the medications as prescribed. And even without a staff who can go into people's homes, we have someone who can call them. However many times a day they need to be called to be reminded to take their medications as they need to. Jewish Family Service has a friendly visiting program, so they can provide either phone contact or someone who goes out in individuals' homes. They have a grant to provide mental health services, also mental health services, and transportation, friendly visiting, rides to medication appointments, medical appointments, grocery shopping, things like that. Office for Aging, as Anne-Marie mentioned, can provide referrals from New York Connects, as well as, assisting with referrals to Meals on Wheels and other programs that are operated under the Office of Aging umbrella. We were very excited this grant round to be able to include independent living as one of our partners. And they have a dedicated peer who can work with our individuals, which was something that was very much lacking last time around. So we're very excited, and they manage our home modification fund. And really, as with all of you, I'm sure, the act of collaboration on behalf of the individuals we work with is really where the heart of the work is done. So next slide. So when we get a referral, most of our referrals come from hospitals. We've been able to build up some really good relationships with the local hospitals so that our gatekeeper is often able to get in before the individual is even discharged. We have a 24/7 crisis call center, so 988 is the national number. We have been associated with them even before they went live as 988. We have 311 in our county, which is 24/7, and they've been trained. They are actually operated by mental health associations, so they have a nice relationship, so we can get referrals as they come into our crisis call center, as well as a lot of local community agencies, including within the partnership. As Anne-Marie mentioned, we can send referrals back and forth. Our gatekeeper completes an intake with every individual referred to us. Some of those are in person, some of those are virtual. And we screen for depression, anxiety, substance abuse, aging needs, social determinants of health, loneliness, and suicidality. And for the most part, we use evidence-based screens for those things, and then have a protocol for follow-up depending on the scores that people have with those screens. And then, based on those results, the gatekeeper refers to services within the partnership or to other community agencies. So one of the things that we don't do directly is case management. But if there is a need for case management, then she would refer to one of our local community agencies who has case management availability. We meet every other week. And we do ongoing data collection. So we do those initial screenings, and then every 3 to 6 months, we do follow-up screenings with folks that we continue to work with to see how we're doing. And then we meet every other week to celebrate the successes. It's important in our work, as it can become so overwhelming, to remember that there's also progress being made. So we focus on those successes every week, kind of tweak the program as we need to, share updates and discuss complex cases. And that's WOJI.
Great, thank you so much. And I mean, I think that specifically the partnership slide where you kind of illustrated all of the different programs involved really kind of shows the many pieces of the puzzle that need to come together to really just kind of even just help one individual with the different needs that they might have. So I did see several questions coming in through the chat, but I think we're going to wait until after Allison has a chance to introduce her program to address those questions. So thanks again. And I'm just going to transition over to Allison Ayers-Hendy, and she is a licensed clinical social worker from the Cattaraugus County Office for the Aging. So there's a little bit of a different kind of component to this particular program. It's more individual, but in her role, she receives referrals for mental health assistance or to support callers who might be emotional through the New York Connects intake process. So she also helps other staff from the county mental health system in this role. And so she's actually able with her licensure to provide direct intervention and support. And so she doesn't actually need to refer clients out to other agencies in many situations. But as Kristen said, if the person's already receiving case management, then that case manager can also directly refer to Allison. But otherwise, a person might contact New York Connects directly to request counseling, or there might be a mental health need that is that emerges through the general screening and exploration of options with a caller. So regardless of how that person's referred to Allison, the process is documented through the New York Connects intake process, and they also have a very good relationship with the county mental health system. So referrals come through and are strong between those two agencies. And Allison was kind enough to share a form that she uses in particular for those intake workers that are taking those initial calls through New York Connects. But first, Allison, can you just go ahead and kind of give us an introduction and explain, your role in this process?
Absolutely. Thank you for having me. So as Amy said, I am a licensed clinical social worker and have been for most of my career providing mental health counseling and treatment to adults of varying ages, oftentimes of the older adults. But in recent years, through a variety of circumstances, I have been employed here at Cattaraugus County Office of Aging as a caseworker. And so through that and through the options counseling that I would do, there was certainly an identified need of unmet mental health, emotional health, adjustment to diagnosis, adjustment to changes of living style, grief and loss, different medical events that can cause or create clinical depression or anxiety. And so we in Cattaraugus County, we're one of the more geographically larger counties, but extremely rural. And we don't have all the built-in systemic supports that maybe some other counties do. So a lot of things were being seen as unmet for our older population. And so through different advocacy and circumstances, we were then able to implement this new role to allow me to use the credentialing licensing experience I already had and being able to provide this now to folks often in home. And so many of the referrals do come to me through the New York Connects referral path. But of course, I'm not the only choice available, but I'm now one choice that if they cannot, due to logistic circumstances, lack of transportation, the health, or choose not to access more of the traditional county clinic things or services, that this can now be offered to them as one of their options to meet the mental health needs. So our intake workers are all aware of the local supports, and now with this new program, our options counselors are also able to present now this as an additional option if someone either reports, they're on an antidepressant but not involved in counseling, and maybe displaying some factors that could warrant some counseling. So, we have kind of a cheat sheet reference. It's very informal for the intake workers, and if and when they do get a call that's related to mental health or emotional health, and giving them resources to link with if there is something of a building crisis mode, or if someone is just simply looking for counseling services that can be available to them. So as Amy said, also, we do have a very good working relationship with our county mental health clinic, which here is known as community services. Our physical design is such that many of the county departments, their primary departments, are housed in one building. So logistically, we have very easy access to the mental health department. So if somebody were to walk in a crisis, but actually it would be better served by mental health staff, we can ask them to come to our office to meet, or we can escort folks up there. They are currently experiencing a staff shortage, so they are now aware of this new service we have and can be a reciprocal referral for some of their overflow when it's age appropriate. And they also have the mobile health treatment team that can go into the community to help meet folks in their home and just kind of bridge that gap and build some rapport and encourage the use of some of the services out there. So we are able to do some good warm transfers with that systemic linkage. And of course, we've already touched on the 988 and the 911 that other systems are available for. We have a local crisis hotline that is operated 24/7. It's actually through the hospital behavioral health unit. So whether they are RNs or certified counselors, they all have good training to man the hotline 24/7. And then you see other possible options for counseling services. So we're just able to provide some names and numbers, or encourage folks to contact their insurance company to find out maybe some private providers in the region that are on those insurance polls, and they can make arrangements themselves. And then some kind of guidelines for appropriate referrals to me. Certainly if they're already linked with counseling services, that's not an appropriate referral. We don't want to cross any boundaries on that, and we certainly don't want to create havoc with folks. So, and I tell everyone that when I do start to work with them, that if we find as we get going that perhaps I'm not the best fit professionally or systemically, if this is not the best linkage for them, that we will then work on what is better, what is going to help meet their needs, and work at it that way.
Wonderful, thank you. And we've heard actually, just through some of our interactions, that a lot of times the callers are just kind of possibly looking for someone to just kind of talk to and vent to. Have you noticed that being more so the case as well? That there may not be any particular mental health needs, but it's more just kind of that socialization, needing just somebody to hear them out.
That certainly is a need. In my particular role, I'm hearing it more from family or friends. Gee, can I give so-and-so, my cousin, my sister, my, stepson, whoever, your card, because I just think they could benefit from it. So I hear it more from family members, but I do think that that's even sometimes an unspoken presentation for folks when they're calling in, that they do just want some kind of connection. And I suspect as we continue to roll this out, because it is fairly new, that we will see a lot more of them.
Great. Thank you again, Allison, very much. That was wonderful. I believe that Teresa and Diane have been monitoring the chat for the questions that have come in.
We have.
Okay.
Would you like one?
I think that would be great. I know we had several during Kristen and Anne Marie's presentation, so maybe we should just start with the top.
Okay, well, I'm going to start with the one I've got up here from New York City. So much of the mental health services will be dependent on the client's insurance. Are your mental health services paid for by Medicare, Medicaid? What if the client is undocumented or doesn't have insurance?
And that question came in for Wilkie, for Kristen and Anne Marie during their presentation.
Okay. Kristen, do you want to handle that one?
Sure. So Jewish Family Service has a grant. So when they have a licensed clinician, they can go out and provide services without fee. For the most part, I think pretty much everyone has Medicare that we've gotten. And we at the Department of Mental Health, we accept Medicare, we accept most Medicaid, most insurances are accepted by our clinic. So we haven't actually run into that as a problem on an ongoing basis. And for individuals who we think should be able to access Medicaid, that's part of what we refer to case management for, and have developed a pretty nice pretty streamlined system to help folks get Medicaid as well. So we've been able to manage things that way.
Okay. All right. We also had another question come in for Kristen and Anne Marie. And that is, can you elaborate on the Home Modifications Fund and how this is funded?
So it is funded through the grant. We put in as part of the grant for funds for home modification. And we're defining that fairly broadly as anything that would help an individual to stay in their home. And it's been obviously hugely popular, successful. We've been putting in ramps, replacing hot water heaters, helping to replace stairs, putting in grab bars. For some of the more extensive modifications or more extensive and expensive, we've been able to do cost sharing, either with the individual or family themselves or with other agencies. We also had one recently, the ramp, I think some of the ramps are actually movable. So they built it and the individual passed. And so they're like, here, we would like to donate this back to you so that you can use it for another family or individual.
Okay. I don't know who this is for, Teresa. You're much better than me at this. But can you elaborate on how the home modifications fund and how this is funded?
Right. So we, so the funds from the grant came to the Department of Mental Health, and that's a line item that we pushed out to Independent Living Inc., our peer agency, and they're the ones who monitor and administrate that fund.
And there's a question about where the actual grant funds come from for Wilkie, where what the name of the grant is.
It's from the state. It's a triple partnership between the State Office of Aging, OASIS, and the Office of Mental Health.
Here's one. How do you address emergency housing needs for older persons with mental health needs who need supportive housing?
So housing is always tricky. I'm sure it's tricky across the state, not just here in Orange. And that is, I think across the board, one of the harder things to address. But we have absolutely supported individuals, whether they're in their own homes or finding an appropriate assisted living facility. As I'm sure we all know, some assisted living facilities have greater capacity to provide appropriate support for individuals who may have a high acuity in their mental health status. We also have some specific supported housing through our adult SPOA, single point of access system, for individuals with acute mental health, ongoing acute mental health needs.
And Allison, also for your county, could you also maybe touch on that question and
Housing is certainly a need here in this county as well. And so we can use some of those very similar setups through SPOA. For our independent living center connection, we actually have someone right here in our office. It's part of our team who is the ILC, so that's another possible avenue to explore. We do have a couple shelters that have staffing on site to at least be aware of and have some baseline knowledge to help with any mental health needs that may be exacerbated because of the housing situation. And then, our assistance and through the ILC and whatnot, helping to look to seek out longer term options for folks. And I hope that's helpful. Yeah.
I have one, and excuse me if I've already said this because I'm losing track. Is there any billing involved with the social worker?
Specific to Cattaraugus County, I think is that what you're asking?
I'm not sure.
Well,
is it
I know
specified?
Orange County touched on their billing, so I'm thinking, but I have the credentialing to be reimbursed by insurances, but at this time, for this particular service through Office of Aging, we are opting not to involve insurance at all, because in some cases that's a barrier to people accessing good, valuable service for what they need. So at this time, we are not pursuing that. We are just viewing it as yet another aging service option for folks in our county.
Yeah, and in Orange, we have opted to go the billing route so that it's a sustainable program, so that the mental health piece can be sustained even post-grant.
Yes. Yeah, so we have not taken that off the table for that exact reason. But for the initial rollout and to see, is the response much as what we suspect it will be, and is there room for growth? And we will pursue that further down the line. But right now we are able to offer it without involving insurances.
Thank you. Teresa, do you see any others? I think we've gotten them all now.
Yeah, it looks like we're caught up with the questions right now.
Okay, thanks, guys.
Teresa, I just wanted to note there was a couple of questions that were answered earlier on in the chat, but in terms of the advancing states training that I reviewed, that web link will be in the PowerPoint, and then it was also in the agenda. So again, the one caveat with that website is that you do need to create an account, but there is no charge.
I see something else, and maybe this has been answered. N4A was mentioned earlier, which is rebranded as U.S. Aging. So I guess that's just some information that was put out there.
Thank you, Katie. And Nanette, I pulled that from the website, so you might want to update that on your end.
Oh, and the ACUU conference is June 26th and 27th. And I said 27th and 28th because that's what my notes say. So what is it?
It actually is, Diane. I put that in the, it's the 27th.
Yeah, it is the 27th and 28th. You were right.
Good.
Okay.
Okay, I think we've got it all. More
right.
information about the conference. We can give you that a little later. Let's move on now.
Yes, thank you
Okay.
everyone for the questions and feedback. And so we are right on target to move on to Jess to give us a quick reporting recap of what's coming due in the April 30th report.
Hi everyone, this is Jessica Willard. I just wanted to give the friendly reminder that your next New York Connects quarterly report is due April 30th for the period of January to March 30th. In this reporting quarter, it will include policies and procedures, incoming call and contact process, satisfaction survey, the other validation for the quantitative section, quality assurance, and then I also do want to give the reminder to submit your long-term care council meeting minutes from the prior grant year, because that ended in March and we still have a lot of organizations that have not submitted. So please go ahead and do that. And I will also be sending out the reminder in probably a week or so, as I always do, with everything that's due and when it will be due. So with that, I'm going to turn it on over to Teresa.
Okay, I just want to check quickly before we, have the information about our upcoming call. Just check quickly if there are any additional questions to come into the chat for either of the presenters or for Erin. If there's anything else that we want to address before we close. Okay, all right. So we will be sending out the recording links by email. The next quarterly training call will be June 6th, 2023, and it will be the same time, 2:30 to 3:45. So the tentative spotlight, the topic will be it's a review of the New York Connects work plan, and I believe that's it. I just want to thank everyone for participating. Thank you very much.
Erin,
Thank you, everybody.
did you want to talk about the conference? Do you have any information on that?
I added a link to Aging New York's website, which has the
Terrific.
information on ACUU in the chat.
Thanks, Amy.
Yep.
Okay. Thank you, everybody, and thanks again to our guest speakers, Anne Marie, Kristen, and Allison. Thank you so much.
Thank you.
Okay, take care. Bye-bye.
Thank you.
Thanks, everybody. Bye.
I'd like to make reservations